Hello, my name is Dr. Siobhan Bhriain. I'm the National Clinical Director for Integrated Care in the HSE, and I'm also the Chair of the National Consent Working Group for Consent to Vaccination. I'm here to talk to you today about consent for vaccination for children under the age of 16 years. So vaccination against COVID-19 of children aged 6 months to 4 years old has been approved in Ireland since January 2023. Most children between 6 months and 15 years old will be vaccinated in HSE vaccination centres, and vaccination of children aged 5 to 15 years old is ongoing. So what is consent and assent for vaccination? Well, consent is the giving of permission or agreement for an intervention, receipt or use of a service or participation in research following a process of communication about the proposed intervention. Assent is the agreement, approval and or permission to an intervention, receipt or use of a service or participation in research following a process of communication about the proposed intervention. And for more information on consent and assent, you can look at the HSE consent policy at the link below. So it's a legal requirement that a parent or legal guardian must consent in advance for the vaccination of a young person under the age of 16. Consent of one parent or legal guardian is sufficient. Consent is required for each dose of the vaccine. Vaccinators will confirm and record consent at the time of vaccination. If a parent or legal guardian is not with the child under 16 years when they attend for vaccination, the child should not be vaccinated until the parent or legal guardian consent has been obtained. And consent for vaccination for those aged 6 months to 15 years. A young person should also assent to receiving the vaccine and may require additional supports to achieve this. If a 5 to 15-year-old does not assent and refuses vaccination, they should not be restrained or vaccinated against their will. For younger children aged 6 months to 4 years, where vaccination is in their best interests and the parent or guardian consents, every effort should be made to reassure the child and minimise distress during vaccination. A legal guardian. Who is a legal guardian? Well, if the child's parents, mother and father are married, both are legal guardians. Following a separation or divorce, both parents remain the child's legal guardian, even if the child is not living with that parent and they have not been awarded custody of the child. Where a child has been jointly adopted, the adoptive parents are the child's legal guardians. Where a same-sex couple is married, the child's biological parent is a legal guardian. However, the spouse or partner may apply to become a legal guardian. Where the child's parents are not married, the child's mother is an automatic legal guardian. The child's father is an automatic legal guardian if, from the 18th of January 2016, he has lived with the child's mother for 12 consecutive months, including at least 3 months with the mother and child following the child's birth. If the mother and father of the child make a statutory declaration to the effect that they agree to the appointment of the father as a legal guardian, and the father may apply to the court to be appointed a legal guardian. Any adult may apply to the courts for legal guardianship if they are married to or in a civil relationship with or have been cohabitating for at least 3 years with the child's parent and have shared parental responsibility for the child's day-to-day care for at least 2 years. If they have provided for the child's day-to-day care for a continuous period of more than 12 months and the child has no parent or guardian who is able or willing to act as a guardian. A guardian may nominate another person to act as a temporary guardian in the event of the guardian's incapacity, and this is subject to court approval. A guardian may also appoint a person to act as the child's guardian in the event of the guardian's death. For children in care, there are different rules. So children in voluntary care, the usual legal rules of parental consent apply. For children or young people under care order, if a child over the age of 16 years is admitted to the care of TUSLA, the normal rules of consent apply. For children or a young person under 16 years of age admitted to the care of TUSLA under a care order, the normal rules do not apply. Best practice, however, does involve the parents in the decision-making process where possible. In situations where there is an interim or emergency care order, an application may be made to the district court in regard to consent to treatment or intervention, including that a social care professional involved in the child's care is permitted to give consent to treatment intervention. For those children under a full care order, be it temporary or permanent, TUSLA is authorised by the court to consent to any necessary medical or psychiatric treatment, assessment or examination. Different procedures apply to admission and treatment under the Mental Health Act 2001. For children in foster care, the consent of TUSLA is required for any treatment or intervention. TUSLA should affirm that they have the legal authority to give consent on behalf of the child. If a child or a young person is in foster care for 5 years or more, the foster carer can apply to the district court for an order giving them control over the child, including giving consent to any necessary treatment. A healthcare worker in this situation should satisfy themselves that the foster carer has the necessary legal authority to consent to the treatment or intervention in question by checking the court order. For a parent to give informed consent, they must have adequate and clearly presented information about the nature, potential risks and benefits, and of alternatives, and not be vaccinated. They must not be under duress, and they must have capacity to make the decision. If there are concerns that a parent or guardian does not understand the information provided or is seeking further information, they should be given the time and opportunity to do so. However, there is a presumption in law that adults have capacity to consent unless there are reasons to believe otherwise. How is consent recorded? Well, vaccination centre appointments may be booked for children and young persons under 16 years of age online via the HSE booking portal, the link is below, or by attending a walk-in clinic. A parent or legal guardian must accompany the child or young person to the vaccination appointment to give their consent, and this record of consent will be recorded on the COVAX vaccination system. In exceptional cases, for example, the parent or legal guardian living abroad, they can contact HSE Live or the vaccination centre, and arrangements may be made to accept consent by telephone. We have had some experience of this, and it has been very successfully worked out when parents or guardians have made contact with us, and we've been able to give vaccination with their consent over the phone. Consent for 16 and 17-year-olds differs from those under 16 years of age. So young people aged 16 and 17 can consent for themselves. Parental support is important, but does not determine if vaccination happens. If a young person of 16 to 17 years of age consents and the parent refuses, the vaccination should proceed. For further guidance on the consent for vaccination of young people aged 16 to 17 years old, please see the link below. And here we have some further links that may be of help in the vaccination of children and young people. Thank you.